Health warning, fever, sickness, the telltale red bumps. Local clinics seeing a 700% increase in the chickenpox. So what's causing the alarming increase, and how can you protect yourself and your family?
And joining us this morning is Dr. Tim Hendricks with Center Care. Good to have you. Always good to have you, Doc.
Thank you.
Thanks for being here. Why are we seeing so many cases of chickenpox pop up right now?
I don't think we really have a good reason for that. We're seeing in the last few weeks sporadic cases, about 7 cases in the last week, and previously we only see about 1 or 2 a week historically throughout the last few years. So we've seen a tremendous decline in chickenpox cases over the years because that's part of our immunization schedule. Kids immunized against it, so we just don't see it out there in the community. But there are people at risk that are either unvaccinated or adults that never got the vaccine. I never got the vaccine, but I was exposed. So most of us adults were exposed in childhood, so we do have some immunity to it.
So one of the things you and I talked about in commercial break, which I thought was fascinating, is that once you get the chickenpox, I had it when I was little too, is that that virus is always with you, that it never actually goes away and can reoccur as an adult. Explain how that happens.
Well, that's a very good point to remember, that this is a chronic infection. Chickenpox or varicella is a herpes-type virus. So it once it infects the body, it stays there for the rest of your life. And in the case of chickenpox, what it does is it reoccurs or reactivates later in life, usually causing a painful rash called shingles. So now we've got another vaccine, the shingles vaccine, for older people to try to prevent that from reactivating and causing that pain. But you know, chickenpox is a serious infection, so there's those 2 aspects you have to look at it. One is that there are complications from chickenpox. Adults that get chickenpox, there's a risk of mortality from pneumonia complications. In younger children, there's meningitis and encephalitis and other neurologic complications. So it's not just a benign disease that, you know, rash that kids get and then they get over it. There are some risks associated with it, including the fact that you can get it again later in life as shingles.
Sure. Okay. When parents come to you, and I'm sure it happens a lot, and they say, Dr. Hendricks, I'm not a fan of vaccines. What do you say to them? Because obviously a vaccination would prevent this.
Right, exactly. So it would prevent the primary infection. It prevents the chance of having shingles later in life. So there's a lot of benefits to that. And the vaccine has been around since 1995. So we have a long track record of safety with this vaccine, as with other vaccines. So you know, there's a lot of chatter and noise out there about vaccines and vaccine safety, but the science just does not support that. We know very well these are safe vaccines, and they can prevent complications, serious complications from these diseases.
One of the things we talked about earlier, which I thought was interesting, is living here in Central Florida, we have a higher risk of getting things like this because we have so many tourists who are coming in and out, sometimes from countries where vaccinations aren't even available.
Exactly. That's a very good point. That number one, international tourists, for instance, our recent discussions about measles and the outbreak throughout the United States, majority of those outbreaks were started by somebody without vaccination against measles, goes to a country where measles is prevalent, and they bring it back. A lot of our chickenpox cases, for the most part in Central Florida, are tourists from Europe. So some European countries don't vaccinate against chickenpox. The child is exposed there. They show up at one of our amusement parks, and they suddenly have a rash, and they're spreading it around. So we all have immunity, so we should be safe. We're not going to see a widespread outbreak of chickenpox in the community, because with the majority of adults and children being immunized, it's just not going to take a hold.
All right, that part is good news. But if you start to spot the signs, go see Dr. Hendricks for
exactly.
sure. Great to see you. Thank you so much for coming in, Doc.